But what we believe will happen in the future is that there will be bilateral agreements, very similar to the one that's being brokered between Australasia and New Zealand at the moment, where governments will be sufficiently confident of the health risks being under control between certain countries that have got similar levels of progression of the recession of the virus. And I think those bilateral agreements will allow us to start to gradually restart. You may have seen that Emirates have already announced some flights to Australia, to certain points in Europe and to America. But obviously, those are very much subject to the health restrictions being lifted and passengers able to enter the countries at both ends of each route.
Paul, as you mentioned, Emirates is now returning some passenger services to normal. What gives you the confidence to bring those passengers back into the terminal in this environment and ultimately the confidence to put those planes back in the sky?
Well, we've taken huge measures to make sure that our passenger health and our staff health is uppermost in our mind. We've done extensive fumigation of our facilities. We've stepped up our cleaning regime to make our airport resemble an operating theatre in terms of its cleanliness. And we are being especially careful to make sure that we observe all social distancing. And we've been one of the first airports in the world to trial testing of customers for COVID-19 before they board the aircraft. So we're taking every step possible to make sure we reassure customers that want to use Dubai, either to depart, arrive, or in transit, as and when the restrictions are lifted, that we are a good, safe bet and a very convenient hub. Having been the largest airport in the world for international traffic, we're determined to retain that crown.
Emirates was out with an annual report on Sunday. It mentioned the word crisis 12 times. Clearly, the airline is under significant pressure in this environment, like many other airlines around the world. But at the same time, they also gave us somewhat of a timeline with regards to a recovery. They said it's ultimately going to take about 18 months at least before travel demand returns to a semblance of normality. Would you agree with that timeline, or is that too optimistic?
I think no one in the travel sector wants to see a faster return than anyone else. I mean, we must get back to business, hopefully as normal, as quickly as we can. But I think the thing is, any timescale at the moment is highly speculative, and it really depends on there being a primary reason for people to travel. And that is, we've got to get COVID-19 under control. There've got to be some primary measures, either a vaccine or a treatment, or a clever digital way of tracking and quarantining people that do have it. I think social distancing as a concept will be quite ruinous for the travel and tourism industry, as it will be for many other industries around the world. So we've got to find a primary way before we can get back to normal travel. And that means easing restrictions and an end to social distancing. There are so many variables in that equation, so many things that we cannot predict and are not within our control, that it's quite impossible to say. But we are planning around an 18-month to a 2-year time horizon. But we'll have to watch and wait to see how the medical profession and the IT experts around the world are able to find ways of controlling the virus before we can be confident that a return to normal travel will be possible.
You mentioned some of those safety steps a little bit earlier, the sanitisation, the social distancing that will be implemented inside the terminals. What does that then mean that airport operations going forward post-COVID-19 look like? Does it mean we're going to see longer queues? People are going to have to arrive much, much earlier if they want to fly to go through these safety checks. Of course, with social distancing, things like passing through security is going to take a lot longer.
I think the thing is, rather than longer queues, I think what it means is it's going to be difficult for airports to operate at the same level of capacity that they had before. And indeed, if these restrictions are limited bilaterally to countries that have beaten the virus, then I think you'll see a reduction in demand. So we're planning around having in the short term a lower capacity level, which means that there won't be inconvenience at the airport. It just means we'll be geared up for lower passenger numbers, which obviously requires more space to operate social distancing. So we do not imagine there'll be a drop in service. We just must make sure, of course, that we observe whatever health precautions are necessary to make sure that people are safe and secure when they travel. How the future of air travel will evolve is going to be a very interesting question. We remain ready to adopt whatever procedures, but I think it really is essential that we have a very rapid and accurate way of testing customers for COVID-19 before they board the aircraft. That's an essential part of it. But really, as I said before, economically and to encourage people back to travel, we've got to have a primary means of dealing with the virus so that we can go back to the normal type of operation, because social distancing is just not economically sustainable for so many industries, including airlines and airports.